So beyond the fun of this exercise is a very serious message and mission. Dr. Jason Fung is the author of the book, The Obesity Code, Unlocking the Secrets of Weight Loss. He is a kidney specialist in Toronto. He's the medical chief at Scarborough General Hospital. Thanks so much for joining us. How big of a health risk is obesity?
It's basically the biggest health problem facing the world. I mean, if you look back at the history of medicine, the 19th century, 20th century was about infectious diseases and that kind of thing. But if you look at the big killers today, they're really all metabolic diseases. Heart disease, cancer, all of these diseases ultimately all come back down to the weight, and we know this. And so really it's the underlying problem of almost, all of the major killers.
And Jason, we just mentioned earlier that childhood obesity in places like China, virtually non-existent just a generation ago. Today, about 1 in 10 children are obese. Can you explain why?
I think it's because we've all followed the Western style of diet, which is one that is highly processed and full of refined grains and sugars. So if you look at the diet in China, for example, in the mid-1990s, yes, they ate a lot of refined carbohydrates in the form of rice, but there was virtually zero sugar intake. But now if you fast forward to 2016, now you see everybody's modernizing, but unfortunately, they're also following the lead of the North American style of diet, which is full of convenience foods, full of refined products, refined grains, lots of sugar everywhere, and that's what turns out to cause a lot of obesity. Fundamentally, what we've done is we've misunderstood what the real cause of obesity is. We've thought that it's all about calories, but to tell you the truth, we've been telling people to cut their calories for 50 years, and it just doesn't work, right? And the funny part is that our studies have proven that cutting calories doesn't work. So we have to get back to really trying to understand what is the root cause of obesity, and it really comes down to the types of foods that we eat, and not just that, but also when we eat. If we're eating all the time, it simply doesn't cause weight loss. So if you look, for example, at the trends in how many meals we eat, go back to 1977 in the United States, it was 3 meals a day, breakfast, lunch, dinner, and that's it. Now you fast forward to the mid-2000s, and the surveys show that everybody's averaging closer to 5 to 6 meals a day. That is breakfast, snack, lunch, snack, dinner, snack. So we're eating all the time, and that plays another key role in the obesity crisis. And we have to look at these kind of underlying problems. What is it, the types of foods we eat, the timing of our meals, and see how we can change it to kind of get back, because it's a growing problem, as you said. And if we don't do something about it, really, we're going to be facing a huge crisis.
Yeah, and it's one thing to have the snack be carrots, but that's not the case. It's people reaching for the stuff that you were talking about. Let me ask you this other question. Medical professionals advocate, of course, exercise and a healthy diet, but some are turning to a different option, which is prescription drugs. More than 1 in 10 people in North America are now on some sort of weight loss drug. Do they work?
Some of them do work, and obviously they've proven that they work. Otherwise, they would not have been approved through the Federal Drug Administration. But the effect is really quite modest. So if you look at the average weight loss, it's really on the order of a few pounds compared to not taking the drugs. These drugs have been around a long time, and many of them have side effects. And that's why a lot of these older prescription drugs have fallen out of favor. And truthfully, that's why these drugs are not as big a seller as many people had imagined them to be, because they simply were not that effective. If you're talking somebody who has 50 pounds to lose, an extra 3 pounds isn't that big a deal. For some people, it may be a benefit, but for most people, it simply wasn't moving the needle.
Interesting. Dr. Jason Fung joining us from Toronto. Thanks so much for your insights.